Welcome to Evening Rounds, first one of 2014. We took a bit of a hiatus over Christmas, but now we're back, and we've got a lot of exciting things lined up for the winter-spring session. Who here is here for the first time? Wow, well, that's fantastic. Well, welcome, everyone. Just to give you a bit of idea of what Evening Rounds is, so it's a monthly speaker series. It actually evolved out of the Healthcare and Social Media in Canada tweet-up group quite a while ago. And basically, we focus on healthcare and communications and social media and digital technology. So we like to bring together presenters from different fields and have some lively discussion. So to introduce myself, I'm Devin Haig. I am a volunteer with Evening Rounds, and I'm also the manager of a sexual health program at the BC Centre for Disease Control. And I've been coming to Evening Rounds for quite a while, and I really enjoy the quality of presentations and the discussion that we have afterwards. So just a few housekeeping items before we get started. We're going to have a presentation for about an hour, and then there'll be about 15 minutes afterwards for Q&A and discussion. We, of course, being social media savvy, are encouraging you to live tweet. You can use the hashtags, you can use hashtag eRounds and hashtag HCSMCA. Unfortunately, it sounds like we don't have Wi-Fi access available today, so I apologize for that. We are videotaping today's session, and that'll be posted on our website along with photos from tonight. So stay tuned to eveningrounds.ca. For the Q&A session at the end, if you look at everyone's the microphone, there's a red button there. If you can just make sure that you press that before you ask your question, because then that'll turn on the microphone, and then we'll be able to capture that for the video. And we would like to extend a big thank you to our presenting partners, which is Providence Healthcare. And they've graciously allowed us to use this conference center. And I'd like to now ask Evan Duxbury, did I say your name right? Okay. From Providence Healthcare to just say a few words and then to introduce our presenter.
Thanks very much, Devin. Hello and welcome to Evening Rounds Volume 14. My name is Evan Duxbury. I'm working jointly for Human Resources and Communications here at Providence Healthcare. And I'd like to thank you all for joining us here in person, on the live stream, and on the Twitter feed. We're very proud tonight to be a partner of this series, and we're very appreciative of all the work Signals has put into it and the entire Evening Rounds team has done. And as mentioned, tonight we're fortunate to have Kieran Aiken, the Privacy Advisor for the BC Centre for Disease Control, formerly a senior legislative and policy advisor with the BC Office of the Chief Information Officer. And he also holds a master's degree in international relations from the University of British Columbia. And so tonight he'll be sharing his thoughts with us on the theme of privacy, social media, and healthcare, and how they impact engagement. So without further ado, please join me in a thunderous round of applause for Kieran Aiken.
So when just to premise things, when I first came here, I didn't really know what the audience was going to be like. I didn't know if you guys were going to be tech savvy, going to be an older audience. Sometimes these things can vary in terms of social media and that kind of thing, in terms of our knowledge. So I've tried to cover that all in the best way. I just wanted to say thanks to Devin and Evan for introducing me and having me here. I'm going to speak for the next 45 minutes or so on this topic. Now, as Evan mentioned, I'm Privacy Advisor at the BC Centre for Disease Control. And there I do a lot of work with data, because data is effectively our business in BC CDC. And by that I mean we do a lot of work related to surveillance, to program evaluation, to research, and that requires huge amounts of data and data crunching. So we have all those kinds of things going on within BC CDC, and it keeps you very busy. But today I'm going to talk about privacy, social media, and healthcare, and give a bit of a rules of engagement in that area. So what I will do to first ask is ask, again, because I don't really know where you're coming from, where are you coming from? Are you coming from an area of healthcare? Are you coming from an area of social media savvy? Who doesn't know social media? Who doesn't know Facebook? Who doesn't know these kind of things? Does anybody not have a Facebook account? It's great, okay, well, that'll make it easier. So I'll just start with kind of an overview of what we'll talk about. I'm going to give an overview of social media, privacy, and healthcare, a few snippets of that area that I think are important. I'm going to talk a little bit about where we are in terms of communication and where we're going with that. And I think these are important because it's not only important to know where we are with how we talk, but how we're looking and engaging in the future. This is stuff that's changing so fast, and you're going to be well aware of this already. And so I might introduce things that you already know, but maybe some things that you don't know. The truth of the matter is that things move so fast that we have to always be ready for transition and change. Who would have known 10 years ago what Facebook is now, right? So it's one of those things. And I will talk about how government legislation is responding to social media. Again, because of how fast things have gone, it's been an interesting transition in terms of communication. I'll talk a bit about the privacy requirements for social media in BC. So again, looking at how public bodies generally are responding to social media and also the ways that they have to, what kind of privacy requirements they have to consider when they're doing that. And then at the end, I'll talk about some rules of engagement. So if you're in a public sector situation, you're working in the public sector, what are some of the rules of engagement? Now, again, this is kind of tailored towards people who might be working within government or working in a public sector field. So people that are like physicians or people that are in a private sector where the laws might be a bit different. I can talk about that, just let me know. You can let me know if something you're thinking, well, I'm actually in this field, I'm just kind of wondering what I have to do. Please, we'll talk about it. We'll make sure at the end we have lots of time for questions that come up. So let's talk about social media. Well, what is social media? Social media is kind of all kinds of things. This is kind of a standard public service kind of social media piece that I pulled. And it really talks about all kinds of things. And effectively, it really is about engagement. Most people kind of know social media from these 5 or 6. These are the top ones that people always know. Pinterest, I don't know. Is Pinterest really super popular? I don't know. I don't use it, so. But people tend to know. People tend to know, they're engaging. YouTube, we know. Twitter, obviously. LinkedIn, Facebook. And there's also a whole host of other ones in this entire sphere that many people don't even know. So thousands and thousands of different applications, different types of applications, all specified towards different types of uses, business, personal, private, all kinds of things. So the sphere is huge and it keeps changing and modulating, growing. Things disappear, they come back. Kind of like a flower with different petals, you know. And that's the idea. And the idea is really, well, what is social media? Well, the way the government approaches, and I say government just generally, BC government approaches social media is, well, we're not going to try to name them all, but this is effectively what social media is. So whatever specific tool or service, the focus is on user participation, openness, and collaboration. These are difficult things for governments to define. So even getting to this is a big challenge. Okay, you're all set. Sorry. Okay. Thanks, no problem. So privacy laws in Canada. Privacy laws in Canada are based on 10 privacy principles. Now, these stem from an entire history of privacy that go back to the 18th century. There was a number of privacy principles that came out in the early 80s by the OECD, the Organization for Economic and Cooperative Development. So the privacy regime has been growing quite, I would say, fairly significantly since the early 80s. And a lot of these different principles you will see throughout all different types of legislation, privacy law, all over the world. For the most part, they're quite similar. And actually, that's quite an interesting thing about this piece of law or privacy law is how similar it is. Now, sometimes the designs and the frameworks that they do these things in can be slightly different, but mostly they cover the same principles. And those principles are about accountability. Governments have to have some kind of accountability for what they do with your data or data generally, personal information, identifying a purpose for why you're using it, consent to collect, use, or disclose that information, limiting collection, so how much information can governments collect, safeguards against protection of that information, accuracy, making sure that that information is right so people don't make a misdiagnosis, for example, or don't have the right data in front of them. Openness is, again, another one, so access to that information. And also an ability to challenge compliance. So we have commissioners, we have oversight bodies that rule privacy legislation. So in Canada, we've got two pieces of legislation that you may know, Privacy Act and the Personal Information Protection and Electronics Documents Act. One is they're both federal, and the Privacy Act is for public bodies, and PIPEDA is for the private sector. Now, these things, in BC, you're probably not going to deal with these very much unless you work in kind of a banking institution or an airport, these kind of things. But in BC, you're going to come across FIPA, which you may be more well aware of, and also PIPA, which is the private sector private sector privacy law. Privacy legislation also exists in certain other types of legislation. For example, the Public Health Act. There are certain rules and provisions within Public Health Act, but some others that allow collection, use of disclosure of personal information for health purposes or other specific purposes like finance or security. Now, this whole framework of legislation is also covered by all kinds of other different pieces that kind of either regulate how it's used or are oversight protections. These kind of create the skeleton of privacy legislation. And so when you're working in government, you're dealing with all these kind of different things. You're dealing with IMIT strategies. So you're dealing with policies on how to apply a law within your particular area. You have information sharing agreements that permit the information flows and articulate to two different bodies what they're planning to do with information. Research agreements, strategies, legal interpretation, and also privacy commissioner oversight. So, there's always an overview that's going on. Now, all these things are changing as well and adapting because privacy, because of the subject matter, is constantly being challenged and changing. And also people's perceptions are changing as well, and how all these all will factor in and control kind of that boat and ship and steering, how it steers through. So this is about the most important thing with privacy is what constitutes personal information and how is it defined. Personal information in FIPA, Freedom of Information Protection and Privacy Act, is defined as such. Recorded information about an identifiable individual other than contact information. So it can be all kinds of things that we're well aware of. Your name, your personal email, your social insurance number, your driver's license number. These are bits of information that can directly be attributed to you and directly identify you. The one exception in this is that it doesn't include business contact information. So anything on a business card generally doesn't apply to this. That's one thing that kind of sometimes fumbles up people when they look at it, or at this definition. And that's what contact information really means. This is actually quite similar. This definition is quite similar across, again, all types of different privacy legislation that are out there. Personal identifiers, now this is an interesting one, and particularly in health, we deal with a lot of this, and this is not a definition of personal identifiers from FIPA, but this is, I thought, captured pretty well what it means, which is basically a piece of information that either maybe on its own or connect with something else could be used to re-identify you. And this re-identification, this kind of idea of a matrix of information, this is something that's very big right now. So we've heard about metadata and all this stuff about, secret services or people taking data, or we had CSIS that was working within the YVR airport and they were pulling data, and they're saying, well, it's metadata. It's not personal information, it's metadata. But these are big contentious issues. What really constitutes how much data people have, how much information they have in bits and pieces to build a profile about somebody. It's very challenging sometimes to deal with, especially in health as well, because again, you're dealing with a lot of little variables and you have a lot of power now to be able to put these variables together. And that's the idea of computational power versus all these little bits. I was, an interesting side note, I was at a conference last week where they were talking about how in places like London Drugs or any kind of shopping market, they are now watching the Wi-Fi signals on people's phones to document what people are doing and what they're doing and where they're going within a store. So again, you have a phone and it's got a Wi-Fi on it. And you walk into London Drugs and you're doing your shopping. Well, it knows that you're here. It doesn't know who you are, but it knows you're here. It knows you're going to the candy aisle. It knows you're going over to buy some batteries because it's pinpointing quite close. And then they know from your signal, because each phone has an identifiable marker on it, they'll know when you come back and you do your same shopping. So that makes you determine, okay, when do people tend to come in? What do they buy at certain times? It's all data. It's all data used for marketing purposes. It's metadata, but again, it makes you kind of think, doesn't it? Is that really my personal information? So I love this guy here. This guy's always off, doing these kind of balancing acts over giant cliffs and waterfalls. But I'm using this really to talk about health and privacy, because really it's a balancing act. In the healthcare system, we have two, not competing, but two complementary concepts to ensure quality and safety. One is the need for accessing information for client care. The other side of it is to protect information as part of client care. So what we've recently started, what is happening more and more within health sector, and I know it's within ours particularly, is that privacy is a healthcare issue. It's a health and quality issue. And there's reasons for that. Again, data accuracy, people having the right charts, and having information systems being in sync with each other to ensure people have the right data on the right people. It's an issue when people have data in front of them that is inaccurate about a patient. So privacy and information, or that information going and being accessed by someone else, privacy is considered a quality issue within healthcare now. But it's tough because they're both doing two different things. One's protecting and one's sharing, and these can be sometimes contentious. And in the finer lines, it can be very difficult to know which way to go. And this is a very special place for healthcare because you don't see the same thing. It's really a trust factor. The only other place that I can think of that would have a similar balance between sharing for not care, but sharing and also trust is in banking systems, where there's significant amounts of trust. You have people that are holding huge amounts of data on you, and you want to trust them. You want them to be private, but you want them to do things with your data in the right way. So how are we sharing and engaging? I like this little slide because it's kind of like someone who documented, okay, well, where's all my information going? I got Facebook, I got my music files, I've got Evernote, I've got all kinds of things. I like the fact that it's actually from 2010, so this is probably totally outdated, and it's probably about 10 times the size, because if you actually really did this, and I thought about it, I thought about doing it, and mine would probably look terrible, because you'd end up, this is nice and clean, but you would probably end up with a massive connection of how people are just sharing data without even ways you don't even realize. And also, all these applications, how are they sharing your data? That's what we also don't always know. So we consider the stats about sharing. I pulled a few of these from Stats Canada, a couple from BBC, and also a couple from a conference I was at a couple weeks ago. The conference was talking about security, and they said 40 billion devices will be connected to the internet by 2020. 40 billion. Now, that's not all smartphones, but that's a lot of devices connected and sharing information, and likely sharing information in some way related to you. So there was lots of discussion and chatter at this conference about Wi-Fi fridges and fridges that can connect and share information about whatever. I still can't quite figure that one out, but the other one was interesting is Wi-Fi toilets. Yes, they do exist. And what are they doing? Well, they can do crazy things like sample urine and tell you how much metal you have in whatever. It's very interesting, but those devices are connected to the internet, and they're sharing information about you in some way. Smartphone penetration worldwide is going up exponentially, and in fact, phones themselves, mobile phones, have been going up at such an alarming rate. Well, not alarming, but an incredible rate. Canada's got over 50% smartphone penetration, so that means that we have half the population using iPhone, Samsung, kind of something that's really connected to the net. So you're really seeing this socialized and people accepting smartphones as being just the choice, as to more simple phones that used to exist and were around. And that will change, and give another 5 years, and those digits will be pushing up even higher. An interesting one of social media apps. This is an interesting one because I'm always kind of confused about Facebook and Google Plus, because they all seem to be integrating with they all seem to want to integrate with my texting. And there's all ways you can text. Now, that's interesting that in some ways in the UK, and this was a piece that I pulled from BBC just recently, was that social media apps using Facebook messaging or Google Plus is actually surpassing the use of texting. So that doesn't seem like much, but it will be if you're a government and you're trying to think about how you're going to talk with people, and people are using company applications and they're wanting to interact with you. That's really complicated for government because they can't always control the dialogue in some way. 1 in 5 smartphone owners in the US has a health app. Now those are all kinds of varieties of health apps, but it's going up really fast. It's interesting. Sharing and caring online, again, huge amounts of people are online. We have the highest proportion of internet users in the country, BC. Interesting. 40% of Canadians are 65 plus use social media, which is interesting because we often assume that when people are older, they don't necessarily are not on Facebook or these. That's untrue. My mom is on Facebook. She can't figure it out, but she's on there somehow. And there's people that are sharing stuff that they shouldn't as well. 2/3 of Canadians use a social media site. It's basically becoming acceptable, and it's just part of our day-to-day routine. Again, some final stats. Facebook, almost 1 billion mobile users. I think it's about, 1.7 or 8, I think, the total Facebook users, but that's considerable. And again, Canada, most active Facebook users in the world. So, online communities. This is another great big one. Now, this is something that I was looking through because, quite frankly, I have not used an online health community. but they're big. There's some very big ones where people are really sharing a lot of data. They are looking at something like Facebook, but they want to do it for sharing information about a health situation or a diagnosis or some kind of counseling. So these are a few that I pulled off. I mean, this, MedHelp, 12 million users per month. These people are talking about their healthcare. They're talking about their experiences. They're talking about doctors. They're talking to create communities and groups, and they're sharing information. They're sharing information, personal experiences, and the like. And there's many more of them. There's specialized communities for kidneys. There's special, for any type of different body part, practically, there is a community that is talking about it. So even health professionals, too. There's social media for health professionals. They're using to collaborate, to bring together, communities to discuss issues. This looks fairly close to Facebook in my view, at least the color scheme. But people are really kind of expanding and sharing information. Now again, they might not be sharing your personal information, but they're sharing information about health and diagnoses, and they're collaborating online. So what does this all mean? I mean, I've been talking about mobile phones, I've been talking about all these engagement things, and the reality is why I'm pushing that message is because technology is making individualized health management more accessible. We are moving towards more control ourselves of actually getting our own data. This one I thought was a funny way of getting your data is to, encourage people to get iTunes credits for walking, and that's a bit tongue-in-cheek, but the truth of the matter is that there are a lot of these types of apps, whether they're mobile or connected to mobile, are in existence. I don't know if anyone's kind of looked and seen or knows anybody who's using Fitbit or any of these kind of Nike Plus, but in my view, they're everywhere. I mean, every time I go into an airport, they're always there, and people are starting to wear them, and they're collecting information, huge amounts of it. It's very interesting. So I don't know if you can see, but there's a couple of things in here. This is a stylish bracelet that connects you to social media, actually connects you and connects all kinds of different things about your moods and all kinds of things. So there's a number of different ones. Not all these are social media, but the one in the center is the one I was trying to elaborate. There's all kinds of other kinds of things. Where's the one? The one here called Smart Activity Tracker in the middle to the right. Calculates stairs climbed, calories burned, sleep duration, quality. It syncs to your Bluetooth. These things are pervasive and they're just growing and collecting amazing amounts of data. So now that you can monitor your sleep. Does anybody have a sleep monitor? I know lots of people that use these. You don't have to admit it, but it's out there, right? People are interested in using these. And that's huge amounts of data that are flowing back and forth. But do you really know who is using that data or who's using the metadata from that? Maybe, maybe not. What was the other one here? Again, another one here. This 24-hour gives you sleep, exercise, motivation, connects to your phone. There are a number of these types that are coming out. There's even one that I saw that was connecting your pets, so you can monitor your pet's health, and that's another interesting, huge area. Pet health monitoring to make sure they're getting enough exercise or getting enough vitamins or they're sleeping right. But here's an interesting twist about data, is that Google Health, now I don't know how many of you knew Google Health, but Google Health effectively died last year. It was in a slow death. It died effectively, I think, 2011. But they really realized, well, I thought it was surprising because Google, which is so good at collecting your data and making it so compelling to add your data to their archives in some way through whatever applications they have, they couldn't get people on Google Health. Now, what is Google Health? Google Health was a centralized health system, effectively, where you added your own medical records or your information. You had a central branch. Google Health is one of many that did this. Microsoft had the same thing. There was a couple others. But they could not get people to join up, which means something to me because I think it means that people are still wary of really having all their data, their health data, in one spot. We kind of like having our stuff decentralized. And we're still kind of not really keen on a lot of certain types of health data being put in the hands of a big private company. So what does it mean to all of us? And when I mean us, I mean public sector generally. Well, it means that we get a lot of email, that's for sure. What it means is social media and communication technologies are really changing the flow of information. People are engaging in different ways. They are sharing more things than they were used to maybe a few years ago, but they're also not sharing things. I think people are becoming quite savvy overall, and especially with new generations that do pop up. I'm still convinced that privacy is not a dead thing. So that's affecting, it's changing. It's changing how we view privacy, but it's also changing how information is flowing. It's interesting if you think about the doctor-patient relationship where, in effect, there was a monopoly of knowledge about information about you in the hands of someone else. It's now changing in another way. If we have Fitbits and all kinds of stuff right now, think 10 years from now, the control that an individual will have about understanding their own information. Now, their ability to assess that information, that might be another question, but it's no longer going to be directly in the hands of a doctor. So at one point where a doctor would be telling you the results, now you're telling a doctor the results, and maybe you're asking them to assess the information that you've collected. It's a big change. It's a big change in how we viewed health data, and healthcare. And it could be quite, we're close to the ability of taking that data and plugging it into a computer of your doctor and having them analyze it. And again, social media is dramatically changing the way we interact and engage with health information, or our health information. I say our in there because if you think of doctors that are engaging on social media networks for doctors or for physicians or for surgeons or for anyone in the health sector, and how they're talking and how they're able to put together a community of practice to determine or make diagnoses or at least get to a closer understanding of an issue, that's really big. It's really different. And the same with us as well about how we take our own health information, we are sharing that information in different ways, in different areas, and doing it online. The deeper we integrate with the digital domain, the more complex the privacy questions. And this is a fact of life for me. The more and more we integrate online, it makes it infinitely more complicated. People don't just live in a country anymore. They live in multiple countries. They live in multiple jurisdictions in a way with their online data floating around and being in different spots. How do you tackle this when you have multiple jurisdictions, multiple different types of legislation, different types of consent, the ethics of allowing yourself or a company to allow you to sign off all your data? It makes it very difficult, and I'll come to that more about how government has it's a tough field for government to operate in because it's private and public, and those things are really coming together, and in the middle is the citizen. So privacy laws have really struggled to adapt to the way people are communicating and sharing information. This is just the fact of the matter. Like if we look at FIPA, for example, FIPA is a piece of legislation that's over 20 years old. Now it stood the test of time remarkably for a piece of legislation that was made basically pre-internet. But it really is hard to apply within Facebook age and how people are operating in social media. It is very difficult. But some factors remain the same. governments, public bodies, we all have legal and ethical accountability to handle citizen information. And I talk about this when we're engaging with people within a social media context from a government point of view or public body point of view. We still have to do certain things. And sometimes those things seem a bit silly or they seem a bit bureaucratic, but they are required because we have a high standard and people expect it. Public sector privacy legislation, effectively, whether you're in the digital domain or the analog, the real world, if you want to call it, it still applies. And this is good for citizens or people. It's also good for government because it covers government. But it's still very difficult because citizens have a very high expectation of privacy from public bodies. That's my opinion based on seeing how people interact. It's interesting how people will quickly go through a consent form and yes, let me join up. And then they go, hey, wait a minute, what have you done with all my information? People don't see government often the same way. They see us as a big bank of information. We hold their health information, financial information, ultimately about trust. But they really, really distrust government in a lot of ways. They don't always trust government to do the right thing. There's always a bit of concern there. So, and that's true if you look at the legislation. FIPA, if you compare it to the private sector legislation, does have more, I don't want to say higher standard, but it's more rigid in some ways. It requires little things like you can't necessarily get consent to collect someone's information. Very rarely can you do that within the public sector. You can't just say, hey, we got this thing, can you give us your information? Just say consent here. Can't do that in government. You can do that in private sector legislation, but you can't do that in government. Government has to have a reason to collect your data. And they have to tell you that. They have to tell you why they're collecting your data, and they have to have a reason. And this also runs through the not only collection authorities, as you would call them, but use and also disclosure. So consent is a factor within FIPA, but it's not in consent or in collection. So how are we responding to social media? Well, we can't just tell people to turn off social media. Government wants to engage, and they want to stay current. I just pulled a few examples of where public sector is effectively engaging in different ways. They're testing the different waters in different social media areas. So, Ministry of Health has HealthLink. In my home, BC-CDC, we've got Immunize BC, Facebook site. We've got individuals that are tweeting about situations. There's a number of different ways that people are creatively using social media. Sometimes not so creative, sometimes very creative. I was reading about a situation where they were live tweeting a surgical procedure. And I thought, well, that's interesting. How do you live tweet that? But they do. And there's a lot of interest to know what is going on. It's an interesting kind of connection, not only between individuals, but also with other doctors. And yeah, so we have people are pushing out information, which is good. Governments and ministries are also going, okay, well, we need to have strategies. We got to figure out how we're going to do this. This is government. We have to have a strategy. So that's what we're doing. The government, and I speak on behalf of BC-CDC. I don't speak on behalf of the entire government, but if you look around, there are different strategies and policies that are being put in place to say, hey, this is how we're going to engage, and this is what we're going to do to engage, and here's the ways that we're going to engage. And this is, from the high level. This can be from the government top end. This can be to the ministries, like the Ministry of Health. This can also be regional communications policies. I'm sure VCH has a communications policy for social media. I'm sure they do. But a lot of times there's a lot of places where places are still trying to catch up. because it is so new. BC privacy legislation has gone through some updates to make it a little more streamlined to the requirements now. And I won't, go into too much detail about the legislative stuff, but these are important, I think, in my world. I worked for a number of years working in the portfolio that dealt with the legislation itself, and it was interesting to see when these were put in, because it was a pretty big change. It's not easy changing privacy legislation, for one. So they introduced a discussion about a social media site, what it is. They prescribed nearly 60 different social media sites that were permissible to use within the public sector. And this includes Instagram, Facebook, all these, the ones that you will know. There's a number there that you can, if you actually look into the regulation, there's probably a number of social media sites that you won't know. Again, how do you cover them all? It's tough. And a lot of these were done to pretty much allow government to engage. One of the examples that government was really getting hung up on was about pictures, because pictures are considered personal information. And they were having a hard time dealing with the ability to collect pictures. How do you collect a picture? Government couldn't collect a picture. This was a big PR issue. So they actually they softened some of the legislation to permit it for engagement purposes, for communication purposes. There's still a whole host of privacy requirements when using social media. We have collection notifications that are a requirement. This is something that tells somebody, and this is part of collection, as I was saying about the authorities, is you have to tell people what you're doing. What's the authority that you have to collect that data? What is the reason? What you're planning to do with it, and who can you contact to find out about, if you have any questions about what's happening. You'll often hear collection notifications if you call, federal government on the phone, or you go to one of the websites. You will see collection notifications kind of indicating this information. This still applies within the online world. There are different collection, use, and disclosure authorities if you are planning to use the data that you would collect, for example, off a social media site. Government does allow, or the legislation does allow for people to collect information. Storage issues, because of course in BC we are not allowed to store information outside of Canada. This is part of our legislation. That makes it difficult when you're dealing with social media sites. Data retention and destruction, privacy impact assessment requirements, and I just put down there again, prescribed media site. You have to have a prescribed media site to work if you're using it as government. So privacy tools for social media. This is kind of what governments are doing to say, okay, we want to make sure that if you're online, that you're doing it the right way. And that can be a bit of an arduous process because privacy impact assessments can be a bit tough to deal with and tough to maneuver. Now, luckily, they've done some good stuff. Back in Victoria, they've already done some corporate privacy impact assessments that have already been completed for things like Facebook and Twitter. And they basically, what that means is that as long as you fall within the boundaries of that, you're good to go. You don't have to do your own privacy impact assessment before you get online. They have a new checklist. They use a checklist, and I've got a couple of examples here as well that I can bring out, and I'll put some up here as well, that say, look, if you do the checklist and everything's good to go, you're fine. You're creating frameworks, and this is how governments kind of try to operate and to cut down some of these requirements, is to create a framework and say, as long as you play within that framework, you're okay. So again, Facebook, Twitter, Blogger, Tumblr, these have been reviewed. And this is just an example of one of these sheets that's asking different types of questions about records retention, what you're planning to do. This is only one small section. I think it's a 2-page document that you have to look through and basically check off. But this is the kind of stuff that is starting to evolve. In my experience, working within BC CDC, I've seen different agencies under the Provincial Health Services Authority. Some places have things in place, others don't. It's all quickly moving. It's so quick that it's hard to catch up. So some places are instituting things. People are sharing types of documents to ensure privacy and ensure that oversight is being done. This is a collection notice. Now, this is a pretty, it's fairly wordy, but it's a collection notice nonetheless that basically says, okay, if you got a social media site, throw this on your social media site. And that's not always easy, because where do you throw it on a social media site? That's a big issue. Again, a lack of control over the domain that you're working in. Yep. Yeah. You will find some variation of that if you go to most government, public, or BC government sites. You should. You should find a collection notification. Now, again, I think it will depend on what government is collecting. If they are not collecting information, if it's strictly for push out, there might be an argument where one won't be there. But again, we're moving into funny areas where people are releasing information in a private context. Government is coming in as a public body and working in a private context where people have already consented to allowing their information to be used or done whatever by Facebook. And government's coming in saying, hey, check out our Facebook site, we're public, but we're working in this private sphere. So, it creates a funny situation where government is not in control of the entity that it's working within. Governments ask contractors or whatever to produce things, or they work in combination with other companies for all kinds of things. But in these kind of cases, it's kind of rather unique that people are living in a private sphere and government's kind of coming in and saying, hey, we want to join too. But they don't have the legal framework to control that information necessarily. So if you look at the wording, it's trying to cover some of that. You know that you're on Facebook and your information might be under someone else's policy or you've consented, but just so you know, we're not completely in control here. But nevertheless, it's notification about what government is doing within that sphere. So I'm just going to finish off here with some rules of engagement. And this is really kind of coming from a privacy lens, but also from, okay, you want to start a Facebook site or a social media site or something when you're in government. And how do you do that? Like, what should you be thinking about when you go forth? So one is obviously know your privacy requirements. So the best way to do this, really, for social media from a public sector perspective is do a privacy assessment in some way. Now, there's privacy impact assessments that have already been completed. Do a privacy checklist. But if you do these kind of things, what they help do is really tweak out and help you to define what you're really wanting to do. So that's one of the things that I'll point to. But for the privacy component, you need to have some kind of assessment to ensure what you're doing is actually above law. Keep engagement non-personal. Now, it sounds kind of funny, non-personal in social media. But what I really mean is keep engagement light. What really complicates things with social media, and this was my experience, was that it's not really a great venue for discussing people's personal issues. Let's face it, it's public. Government should not be getting involved, or public bodies generally should not be getting involved in discussions with people on personal messengers or whatnot, because again, it's out of their control. And it puts government in a tough situation. Again, because advocating the use, for example, of communication within a private sphere. So when I say keep engagement unpersonal, I mean keep it light. The real beauty about social media is to push out information. And for government, it's really a great tool for pushing out information about certain things. You will notice any of those sites that I was putting up, Immunization BC, they're pushing out messages, they're pushing out information. One of the greatest sites that I saw, and it's not health related, but just to give an example, was the BC Wildfire Service. They have a Facebook page. I think it's got like 25,000 likes on it. That seems kind of odd for wildfire, but it's actually giving people something that they're interested in, which is, hey, is there a fire? I see smoke. Is that something burning down? Should I be aware of that? And they post information about roadways being blocked, and there's a fire over here, so just watch out. There's lots of smoke coming in. People find that stuff really useful because they can just find out and they can avoid it, or they at least know that their house is not on fire or their city's not on fire or whatnot. So keep it light. When people come to you and ask you questions, you can use social media to help direct people in different ways. You can provide them with information. It's really great for pushing out information. That is the easiest way. That being said, we do have flexibility within the legislation to allow engagement back and forth. But that's not the kind of engagement that you really want to have when you're really having a personal discussion with people in a public sphere. That just gets complicated, and it's probably going to put you off board. Review your social media policy. Many places have a social media policy that dictates a number of things that are important, like having a moderator, ensuring that you have a kind of a policy for vulgar language or issues that have absolutely nothing to do with your social media site. This always comes up. This is a communications thing. You have to have some kind of way to frame the use of your site. And that was number 4, is assign a moderator. Super important. You need somebody who really understands social media, not even really understands, but understands the site, maybe understands the content that you are putting out. It's very important to have somebody in that role who can talk to people about what the use is, or at least is actively watching the site. That's just really important, especially when you're dealing with contentious issues. There's lots of things. Government's often a place where people want to voice their opinions on all kinds of things, and they often want to voice their opinions on sites that have nothing to do with the topic that they're talking about. So how do you deal with that? Know your audience. Now, this is a little less privacy, but this is a little bit more about when you're actually thinking about creating a social media site, what are you really creating it for? Who is your audience, and how are you trying to connect with them? Because I've seen a lot of cases of social media where people wished or wanted to get involved in Facebook or mostly Facebook, and I thought, well, what is really the purpose of your area starting a Facebook site? There's a million different sites already that exist for putting out the exact same message. Do you really think people are really interested in what your area is doing? It's not my call to say that, but that's what you just kind of, you think, oh, everybody knows Facebook sites, for example, that were set up that no one goes to. They just become inactive because after a while, nobody seems to find them interesting. Government can fall in the same position, but we have there's requirements there that are a little bit beyond the individual. Start small and monitor outcomes, also really important. Engagement with people takes time. And a lot of people, I think, go in with this great idea. We're going to get on social media. We're going to tweet everything. We're going to Facebook everything. And then, the reception or response is not that great, and then it kind of dies. That's not the way to go. It's like too big, too fast, or lots of energy, and then it kind of drops off. And then what's the purpose? There's a lot of things that it requires you to set up a social media site. Why have it die so quickly? So monitor your outcomes and see how see what is really sparking interest. This is also important for a moderator who's going to be actively watching and saying, oh, these things seem to bring more people. There's more response or more audience or more interest. And the 5th one, the final one, is prepare for transition. And this goes back to what I talked about at the beginning, is that the modes are changing. Social media is always changing or modifying. People's interests are changing rapidly. And internally, for a public sector worker or an area, is, well, what happens if your moderator moves on, or that social media person that you were working with was really involved, but they've now moved to another job, and now you have this site and you don't really know what to do with it. You have to have some kind of transition in place. So to not only for the reality of changes in terms of communications and how people are engaging, but also for your own transition policies. As what governments are always dealing with is situations where a subject matter expert moves somewhere else, and then there's an emptiness of knowledge about how to do things. And nobody wants a site to go inactive because there's nobody to run it. Same thing goes for sites that do go inactive. Do you have an exit strategy? Do you have an exit strategy to close a site if you need to? It's no longer useful. We've got a new site that's doing a better job of spreading our message, etc. So it's definitely a thing to think about, is there's an end sometimes to social media as well, and the beginning of another one. So I got some resources here. I'm happy to give these out in another format. These are basically just a sum up of some of the different things. The PIAs and checklists, that's, again, if you're in that area, you're wanting to do some vetting, that's the place to see some of those checklists. That'll give you a good idea of what you have to do with privacy. And then finally, questions. Please ask me anything. I'm hoping that was useful. I'm coming from a bit of a public sector side, but please, if you have any questions about this, or social media, or government, or whatnot. Or you can just simply read the great questions that come out of Google Complete, because we all have had these questions come up where you think, really? People ask those questions? So.
Can you give us an example of something that would require a privacy impact assessment, given that so many of the tools that we commonly use seem to be covered under the government checklist?
If you were, for example, I would think if you were planning to extract the data in some way, or use that data, or somehow follow up, where you were trying to contact people to follow up on something in a different way. So one of the things that people talk about, and this is, of course, this is analytics, is scraping data from Facebook sites or whatnot. This is permissible within your own area, as I've been told. But if you were to do something with that data in some way, you were planning to go and further contact people on Facebook and say you wanted to set up something, or you thought, well, you're someone who's interested in immunizations or some kind of area, we want to follow up. Would you be interested in connecting in a different way, like something like that goes a bit beyond the kind of push-out strategy. That's the way governments are really, or public sector is really kind of looking at social media, is push out information. Engage, but don't do it too heavy, just engage a little bit. So I think it would be, when things follow that line, or that you're trying to further connect with people, or you're planning to do a larger grouping of data, that might be something that would fall in line or fall out of line. Again, the checklist, I think, is pretty good for at least determining whether you're in or out. Yes?
Red light. Anyway, the question I have is so how does the way of thinking about non-personal sharing of information extend to ideas like sites like Patients Like Me, where there's a lot of sharing of personal information about healthcare needs?
It's a different area, because you're dealing in an area where people are operating within a private sphere. So that's a private company that set up a private website. When you join in, you're signing a consent that says, by joining, you agree to X, Y, and Z, and whatever that may be. So it's different. And again, this comes down to consent. Private sector areas, largely operate on consent basis. So you sign, you're consenting to all kinds of things when you join Facebook or, you know, YouTube, and often it has to do with how they're sharing. That you allow, you know, a lot of ways to stop you from suing them to do something is the easiest way, but it also has to do with your data and how they're extracting data from you. That was one of the big things about Facebook in the early beginnings, was people were in an uproar about, oh, they own all my pictures, they own all my communications, and that kind of thing. It's consent-based. And governments can't work the same way. They can't just say, well, join the site, and by doing so, you're allowing us to do all these things. Government has to have a particular reason for what they want to do, and they have to voice that at the very beginning. They can't just collect data just for the sake of it and then figure out something later when they want, oh, we got all this data, let's do this with it.
So would that limit our ability to develop platforms for patients that have shared illnesses to collaborate or talk to each other, or?
Not necessarily. I think that there is ways that you could introduce consent into those areas, but government would also have to be in control of that space in some way. Either they're in control, or whoever they're working with who is operating that control area has some kind of legal relationship where they're also under the same legislation. So this is what often happens: is government contracts out to do something, and they say, well, you have to operate under our legislation. You can't operate under your private sector legislation. They use a mechanism called a privacy protection schedule. So it says, you operate in the private sector. Well, by putting this in, you actually operate under our legislation. So you have to operate under our game. Any others?
I just have more of a comment than a question. I'm coming from the private sector and moving into the public sector, and specifically for social media. So I was particularly interested in your topic because it's relatively foreign to me. What's somewhat depressing, to be honest, is that I know with Facebook, for example, the less engagement a Facebook page has, the less visible it is in that social network, which is a considerable social network, the largest in the world. So from my perspective, I'm trying to, do a good job and try to increase engagement. But in fact, it sounds like I really shouldn't, given it's in the public.
Again,
with the public sector.
It's an area where it you don't want to be, if you think healthcare, I mean, you don't want to engage in discussions about people's personal health issues within a public sphere. It doesn't sit right with government, with public bodies, and it's really not the place to do it. People should be having those kind of conversations well, they shouldn't be doing it on a Facebook site. They could be doing it in other forums, or a forum that is a little bit more controlled by government, where it releases some of the requirements of government through the architecture, or through the certain amounts of consent. But again, it's difficult. Government's in a real bind when it comes to private companies, social networks or social media companies, because they have their own rules and their own legislation, and it doesn't matter what government says, is you've signed consent already. You often see in social media, or Facebook, people put down these funny little kind of legalistic terms to say, I do not allow people to do anything with my information. This stuff doesn't mean anything. You've already signed, consented. It would never get anywhere just because you decide that people can't use it. You're using Facebook. You're under you've consented to and agreed to their huge set of terms of conditions, and it's consent. So government's in a tough spot. So yeah, government bodies, public bodies, get in a situation where they want to use it, but it's hard legally to operate in that sphere. And that's what I mean about being outside of control. It's not that government wants to control everything, but it has to control it for its because of legal requirements or privacy requirements. So it's a tough spot, and that's again why social media is great for pushing out, but pulling in, that's where the tricky part is. You want people to engage and talk, but kind of not always the best. It's sometimes Facebook is not always the best medium for that kind of conversation. It's tough, I agree. Mm-hmm.
Are you following the case in Canada where Facebook's actually probably going to go to the Supreme Court?
I haven't been following it, to be honest, but this is often what happens. Again, there's trickiness around consent, and it's ethical. There's ethical issues and consent issues always within social media. What can people be permitted to take or use? What is ethically? How much do people know? How much do you have to do to make people know? These kind of things. These are tough spots. Anyone else?
I have one more. I'm wondering if there's an opportunity or do you think there's an opportunity for government to sort of go back to the public and say, how do you want your information shared, or how do you want us to use your information to improve your health care? Is there an opportunity for that?
I think there definitely is. I think this is a big growing thing in at least our area, is that people don't generally have a concern with their information being used for health research. I don't, if I see that as a good use of my data, right? I mean, government or a public sector area is wishing to use it to further advance our knowledge of, fighting disease or whatnot. I have no issue with that. Government does, these kind of requirements mean public bodies have to tell you what they're doing with data all the time. But on the larger context about how people are using data, there are certainly ways that public bodies tell people how they're using it. There's a lot of ways that we don't even realize how data is being shared, especially in health. Health is like an integrated system. It's kind of a bit of spaghetti in terms of how things come together, but it's ultimately a big system. And we don't know what we don't know because it's complex. So I think public bodies do try to explain that. Sometimes it's too difficult to explain how things work. But that's not an excuse for not telling. I think transparency is definitely the biggest thing. So, but that's a much larger issue about sharing.
Just going to speak to that point. I mean, it seems like the Canadian system will have a problem following what has happened now in America with the Affordable Care Act has now part of that, part of the sort of legislation that has moved into, is being implemented, is that individuals will have the right to manage their electronic medical records. Mm-hmm. And so that's moving from, say, a private side to being very much within the individual's side mm-hmm. of that management, and then allowing third parties to now do that work for you, that you might sign on with, a certain provider who will manage your mm-hmm. electronic medical records. And so I was speaking with someone about that recently, saying, what do you think this will mean for Canada? And they sort of thought, it's going to be a long way off. Do you have an opinion on sort of where the EMR thing is headed in North America and in Canada?
Well, I can comment, and I can say that, our privacy legislation in Canada is much more robust than it is in the States. The States has some privacy-related consideration, but they're not really national, apart from HIPAA. But they don't have a privacy act nationally. They don't have these kind of things. A lot of it is based on individual regulatory regimes or whatnot. So it will allow more sharing, which probably is in some ways a good thing. But on the other side, these questions about who is getting sharing, what means when you sign off, it raises a whole host when you don't have an overview kind of a privacy framework that's kind of restricting data. It's well known that integration has got benefits, but it's also got drawbacks. And the other side, of course, is frameworks provide oversight, but they can also limit your ability to do things. So, anyone else? No?
I actually have a question. Well, it's more of a comment. Really.
Sure.
Just the point that you made about sharing really personal health information in a public sphere is kind of frowned upon. But, oh, yes, a microphone. But the flip side of that is also, one of the websites that I manage, it's a sexual health website, and we really invite people to send in questions, and it's amazing the level of detail that people will go into. And these are questions that are posted on the website and forming an FAQ section. They'll go into incredible detail about their kind of personal information. And I think that that's also important to be able to have that opportunity, because then it creates dialogue, and it also kind of normalizes, certainly within STI and HIV prevention, there's a lot of stigma. And so being able to kind of talk openly about different issues and almost normalize that. So I think it's an interesting balance between too much and not enough.
And it also, of course, depends on where the environment is you're doing it. So if you're doing it within your systems, you've got more control, you've got better moderation, you are in control of the system. So you know where that data, what is being done with that data, and it creates a different dynamic than having that conversation on Facebook or, you know, in a different area. So you're right, engagement, it's great. It's great for bringing a lot of stuff out. But again, it depends where it's being done. That's, I think, the big thing. So. Yeah. No more questions? Thank you.
Okay.
Thank you.
Thanks, Karen. That was really interesting. And with the links that Karen included on one of his last slides, we can post that on the Evening Rounds website as well. So I just wanted to say thanks again to Karen for his excellent presentation. It was really interesting, and I learned things, which is always a bonus. And thanks to everyone else for joining us tonight. Our next Evening Rounds event is going to be number 15, and that is March 18th. So it's the third Tuesday of every month. So this next presentation on March 18th is going to be around digital storytelling. I don't have much more information about it, but I think it'll be an interesting presentation. Thanks.